Hello, I'm Dr. McCall and I'm your instructor with Nursing 108, and I'm going to have a video made today showing you how to do your medication administration for Module 7 and 8. Now in Module 7 we're going to be doing the PO medication and the IM injection, and then in Module 8 we'll do the insulin, which is sub-Q, and the IV push medication. It's important for you to make sure that you have plenty of lighting, that you're organized, and that I can hear you. If I can't hear you, I can't grade you. You also want to stay within 15-minute time frame. Follow the checklist and you should do fine. Okay, so the first thing I want to do is do my 3 checks of my medication administration. So the first thing I'm going to do is my 3 checks. So I'm looking at my MAR, and I've got Ducosate 100 milligrams tablet orally and halopuridol 2 milligrams IM. Those are the 2 drugs that I'm going to be giving to Millie today. So my first check is as I'm getting the medications out. So I pulled the medications from the Pyxis machine, and I have my Ducosate 100 milligrams. I'm comparing it to the MAR. It is a tablet. I'm also checking the expiration date, 11/21. It's June of 21. So I've got that, and I've got my medication cup. It's my first check. Also looking at my Haldol or halopuridol. I'm going to be giving this IM. So I have my Haldol, 5 milligrams per ml. And I'm thinking to myself, I'm supposed to give 2 milligrams. So there's some math here. So if I have 5 milligrams per ml, I have to do some math to figure out what I'm going to be giving. So I've done my math, and I'm going to be giving 0.4 mLs of this medication. I've also checked the expiration date, and I've got my syringes here. Now I have a 1.5 inch needle, which I probably would use a 1 inch needle for Millie, but I don't have that available. But if you verbalize, that would be fine. And remember that this is sterile, so you don't want to contaminate the tip of this or the top of your needle, which I'll show you in just a minute. So now that I've done my first check, I'm going to go prepare the medication. So as I'm preparing, I'm going to do my second check and get them checked again. So now I'm doing my second check. I've got Ducosate, 100 milligrams by mouth. I'm going to open my tablet, put it in the cup, and I've got a glass of water to go with that. And then my second drug is my Haldol, 2 milligrams intramuscular. So now I'm going to open my needle, and I'm going to be very careful not to contaminate this, because that right there is sterile. So I'm not going to contaminate. I'm going to open it very carefully and connect it without touching it. Now once it's covered, you can set it down as long as it's covered. So now I'm going to draw up this medication. I don't need gloves on until I am at the bedside injecting it into Millie. Remember, your gloves is to protect you from any blood or drainage from the patient. So this has a cap on it. I still have to clean the top for about 5 to 10 seconds with an alcohol swab. And then I'm going to remove my cap, and I'm going to draw up 4.4 mLs of air and very carefully inject that into the bottle. And then I'm going to turn it up. Now sometimes you might get a lot of bubbles, so you can push it back and forth until you get what you need. Make sure that your needle is out of the bottle so that you're underneath the liquid. You're not drawing up air. Okay, so once I have my medication, then I'm going to do the one-handed scoop. I don't want to pick it up because I could stick myself. So I'm doing a one-handed scoop method. You just put it in the cap, raise it up, and there you go. Now I have to label this. So I've got my tape, or you can use any kind of label you want. So I'm going to put on here what this drug is, and it's Haldol. And then I'm going to attach it to my syringe. And I don't want to attach it up here so I can see what I've got. So I've attached that to my syringe. And now I'm ready to go see Millie. So now I've got my medications. That's my second check. I go into the room, knock, knock. Hi, Millie, my name is Christina. I'm gonna be your nurse today. How are you doing? Can you tell me your name, your date of birth, and do you have any allergies? And so I'm checking her armband as well. And on her armband, she tells me, well, my name's Millie Larson. And my date of birth is whatever it is. And I'm checking the date of birth, her name, not only to her armband, but also to the MAR, Millie Larson, date of birth 1136, medical record number 123456. So I've checked all that. And then I'm gonna do my third check before I give it, but I'm also gonna tell her what I'm doing. So I'll say, Millie, today I'm gonna be giving you some Ducasate, 100 milligrams, and I'm gonna check this against the MAR as I'm telling her what I'm doing. Now this is a stool softener. Have you had any diarrhea recently? And she'll say no. So I said, okay, I'll be giving that to you by mouth. And then I also have Haldol. Haldol is just to help you with a little bit of the anxiety, help you relax a little bit. I'm gonna be giving that to you in your deltoid, which is a muscle in your arm. And it will sting just a little bit, but hopefully you won't be too uncomfortable. So that's my third check. Now I'm ready to give my medications. And I've checked my meds 3 times. I've also had 2 forms of identification. I've explained the procedure to the patient. And so when I give my landmark, I'm using a piece of fruit here, but on the deltoid, I would do 2 to 3 finger Brits down from the shoulder. And once I'm at that site, that's how I know. And it's kind of like a pear shaped. So you kind of want to show that either on yourself or your piece of fruit on the video so that I know that you're aware of the landmark. Okay, so now I'm going to give her the PO medication first. And I'll say, Millie, here's your Colace. And I'll give her a drink of water. And she takes that. So now I'm going to document that I gave that. And what I'm documenting is I'm going to put my initials. And I'm going to put that it was given. So now I'm ready to give her IM injection. So one thing that I did forget at the very beginning is my hand sanitizer. So you always want to do that first thing. So I probably would not have passed this, but I did state that I would have washed my hands. So I would still pass you on that. So I've washed my hands and I've washed my hands again just now. Now I'm going to put on my gloves. Okay, I've got my alcohol swab and I've got my medication. I'm doing my third check now. I'm checking this against the MAR and my label. I have Haldol 2 milligrams. I'm looking at the vial to make sure it says 5 milligrams per ml, so 0.4 is what I'm giving. And I'm giving it to her in her deltoid. I get my alcohol swab. And I'm cleaning in a circular motion from in to out. And then while that's drying, I'm going to get me a pad that I can put on top so that will apply gentle pressure. So now I'm ready to give the injection. Okay, Millie, I'm ready to give your injection. I'm going to pull the skin taut. Don't squeeze it for IM. Pull it taut. Always give your IM injections for any IM injection is always 90 degrees. You don't have to aspirate unless your policy at your facility tells you to. 1, 2, 3. I'm going to go straight in. I'm going to stabilize the syringe by holding it in the bottom half of the syringe. I'm going to inject it slowly. Pull it straight out. Apply pressure. Don't rub it. Put my safety on and put this in my needle box. And then I'm going to inspect the site, make sure it's not bleeding. If need be, I would take and put a Band-Aid on it, which that's my Band-Aid that I have today. Okay, and then I'm going to document that I gave her her Haldol, and I'm going to put that I gave it in her right deltoid. And I'm going to remove my gloves, do my hand sanitizer, and see if she needs anything else. And that's Module 7. Okay, so now we're going to be giving Millie Larson her furosemide, or Lasix, and her insulin, Lispro. So this is going to be IV push and sub-Q injection. Remember that you want to be organized, have everything together, make sure I can hear you, I can see what you're doing. And remember to do your med checks 3 times. Okay, so I am going to do my hand sanitizer, wash my hands. I'm in the med room. I'm going to prepare my medications. That's my first check. So the first thing I want to look for is my furosemide 20 milligrams. So I pulled it from the med cart and I see furosemide 10 milligrams per ml. Now, this may be different from what you have because I have a different bottle. So whatever you have listed on the bottle is what you're going to use. But for me, I have furosemide 10 milligrams per 1 ml. And on the MAR, it says to give 20 milligrams over 2 minutes. So I'm going to be giving 2 ml since it's 10 milligrams per ml. That's my first check. The next one, I'm supposed to give Lispro 10 units sub-Q. And I've got Lispro 10 units. There's no calculation with insulin. It's strictly how many units you're going to give. And I also want to say, make sure you have an insulin syringe. Insulin is only to be given in an insulin syringe. And then, of course, I have a syringe and a needle for my IV push. It doesn't matter what size needle that you have because IV push it's a needleless system. So we're not going to be putting a needle in there. Also, you want to make sure that your IV site is correct connected, right? This is the end that you put the medication in. And I also want to make sure that I have 2 IV flushes. And I can go ahead and open these because they're covered with a cap, so I can lay those down. Okay, so I've done my first check. I'm going to roll down the hall outside Millie's room, and I'm going to prepare the medication. This will be my second check. So as I'm preparing, I'm doing my second check. So the first one is furosemide, 20 milligrams IV push. I have furosemide 10 milligrams per ml. So I'm going to be drawing up 2 mLs. So I'm going to get my syringe and my needle. Remember, it doesn't matter what size needle that you have. Just be careful. Do not contaminate the tip of this because it's sterile. You don't want to use a dirty needle, right? And then I'm going to connect this with no contamination. And again, once it's covered, it's okay to sit it down. So now, I'm going to pop the top off my bottle, get my alcohol swab, and I'm going to scrub it 5 to 10 seconds. Pull this straight out, and I'm going to put in 2 mLs of air because that's what I'm drawing up. Put this in the syringe, in the bottle. Push my air in. I'm going to pull back. Sometimes you'll get air. You can push it back and forth if you need to. Just make sure that your needle is underneath the liquid. Otherwise, you're going to draw up air. You can always draw up more than you need and then push it back up and the air will go in. So I've drawn up 2.5 and I'm pushing up to get the air out. And now I've got 2 mLs. Pull that out. Again, I'm going to do the one-handed scoop method. I don't want to contaminate anything. The next thing I'm going to do is I'm going to label my syringe. Always have to label your syringes. So I'm labeling that this is Lasix or furosemide, and it's 20 milligrams that I'm giving. And I'm going to label my syringe. Okay. And I'm doing my second check. Furosemide 20 milligrams IV push. I'm also making sure that I check the expiration date on my medication. Expires 2025. Okay. So the next one I'm doing my second check now with my insulin. I have Lispro 10 units sub-Q. Lispro insulin. And it expires 2025. So now I'm going to pop my top. Got a new alcohol swab. Scrubbing it for 5 to 10 seconds. I have an insulin syringe. Insulin syringes are usually orange. They're easy to spot. I'm going to pull my cap straight out. And I'm going to give 10 units. My syringe is a 50 unit syringe, so I'm going to give 10 units. Put my syringe in, push my air in, pull back. Insulin really needs to be drawn slowly or you'll get a lot of air bubbles. So I can pull back to say 15 units, and then as you push up to 10, if that's what you're giving, you'll push the air bubbles out. Then once I finish, I'm going to do the one-hand scoop. Insulin syringe is a little difficult with that. You don't want to push it too tight, it will bend your needle, so just as long as it's covered. So now again, I'm going to label my syringe. Now I'm giving less pro. I've done my second check, 10 units. And I'm labeling my syringe that I've given Lispro. Okay, so now I've got my medications and I'm ready to go see Millie. So I knock on the door. Hi, Millie. I'm Christine. I'm going to be your nurse today. I've got a couple of medications for you. One is, and I'm doing my third check as I'm talking to her. But before I do any of that, I need to ID my patient, right? So I say, hi, Millie. Can you tell me your name and date of birth? And I'm looking at her armband.
Larson.
And I'm comparing it to the MAR and what she's verbalized to me. Millie Larson, date of birth, 1136, medical record number 123456. And I'm comparing that to the armband as well. And do you have any allergies? And she says, no, I don't have any allergies. And of course, on the MAR, it says no allergies. So now I'm explaining to her what I'm doing, but I'm also going to do hand hygiene again. And I'll say, Millie, I'm going to be giving you some furosemide. This is for your heart failure. And it just helps get some of the extra fluid off. I'll be giving that to you in your IV. And I'm looking at her IV to make sure there's no redness, no edema, no swelling. And of course, your IV should already be clamped here at this clamp. And then I'm going to tell her, I'm also going to give you insulin for your diabetes. It's 10 units. I see that you have a tray in front of you because this is very rapid acting insulin. So I want to be sure you have something to eat in front of you. So now I'm going to put on my gloves. I've done 3 checks. And I'm making sure that I've done my 7 rights. Anytime that you're giving medications, you want to make sure you've done your 7 rights, that you have the right time, which this is ordered now. You have the right route. We've talked about its IV push and sub-Q. The indication, we talked about how it's for heart failure and her diabetes. And then, of course, I've identified my patient, the right patient. I've identified the drug, the dose. I have got my furosemide, 20 milligrams, and I've got my Lispro, 10 units. Okay, so let's do your sub-Q injection first, Millie. So I'm going to get a new alcohol swab, and I'm giving this to her 2 inches away from her umbilicus, in her belly, in the lower right quadrant of her abdomen. I've explained that to her. Take my needle off. And I'm going to pinch the skin. So I'm pinching the skin. Okay, Millie, you're going to feel a slight stick. 1, 2, 3. Now you can do this. I forgot to tell you. You can do this at a 90 degree or a 45 degree. A lot of folks don't understand a 45. So I'm going to show you a 45. So because Millie is thin, I want to do a 45. Because there's the dermis, the epidermis, and underneath there's sub-Q or fat tissue. Underneath that is muscle. And because she's thin, that's why we pinch it up. So I'm giving it a 45 degree angle. 1, 2, 3. Inject her insulin in. And I'm going to remove it. I just apply gentle pressure with my gauze pad. Apply my safety. Put this in my needle box. And I'm inspecting the site. There's no bleeding, no bruising. And that's why we apply gentle pressure. Don't rub, just apply gentle pressure right after you take the needle out, because if you don't, you'll see a lot of bruising. Okay. Next, I want to give her an IV push medication, which is furosemide. I've looked this up. I'm going to be giving it over 2 minutes, and that's per your Davis drug guide. So the first thing I'm going to do is I'm going to clean this for about 10 to 15 seconds. And I'm scrubbing this like I'm juicing an orange, squeezing, rubbing along the sides and the top. Okay, and this is why I don't want it to touch anything. I've got everything prepared so that I can kind of hold this up. So now I'm going to give 3 mLs of, and in your syringes, it has 10 mLs. So you'll see a little air bubble at the top. You can pull that out. And because it's 10 mLs, I'm going to push it up to 7. So I'm going to connect this. Okay, so I've unclamped it. And now I'm going to check for blood return. A lot of students forget this step. And why do we check for blood return? The reason is I've not only inspected her IV site, but I want to make sure it's in the vein. So if I push this in and it swells, it's outside the vein. So I'm pulling back to check for blood return. Now, of course, you're not going to get blood return on a mannequin. I just used a bottle with a towel around it. You can use whatever you like. So I pull back, check for blood return, and then I'm slowly going to inject only 3 mLs. Of course, it's going to leak everywhere because it's not soaking up. Okay, you don't have to clamp this until the very end. So now I'm going to remove my syringe, get a new alcohol swab, scrub this again for 5 to 15 seconds. You want to scrub each time in between. Now I'm ready to give my medication. So I'm going to remove the needle and place that in my sharps container. Attach my medications. And now I have a second hand on my watch. And I'm going to give this over 2 minutes. And so when you're giving this over 2 minutes, you're thinking, if I have 2 mLs, then at about 1 minute, I should have 1 mL in. So you want to give it very slowly. Not all medications are given at the same time. Some medications are given over 1 minute or 30 seconds. Some medications are given over 5 minutes. So because of the time, of course, on your video, I need to see you do this over 2 minutes, but I'm going a little faster here so that we can get through the video, okay? So I'm giving it slowly, and if I were a student, I actually use 2 minutes of time. And once I finish with that, I'm going to remove my syringe, put it in the needle box, get a new alcohol swab, scrub it again, 5 to 15 seconds, and now I've got my second flush. Now for this one, this time, I actually pulled out and put it down to 3 mLs. Attach your saline, and you're just going to give this slowly. And then once you finish, you're going to clamp it off, and then remove your syringe. And you're going to assess your IV site. Is it edematous? Is it red? Is it draining? And ask Millie, how does it feel? Feels fine. So now I'm going to document all that. Now, last time I documented after each medication. This time I'm documenting everything that I gave at one time. It doesn't matter as long as you document. So for the furosemide, let me just take my gloves off first. Remove my gloves. Wash my hands. And then I'm going to document. So for this one, I'm saying that I gave Lasix 20 milligrams, which I did, for edema and her blood pressure. And at the injection site, it was in her right forearm. And of course, her IV site assessment before and after was done. Any lab values, of course, you would check her potassium, her sodium. That's not necessarily required for this video, but it's on your MAR just so as you go through the nursing program, that's something you will need to know. And of course, you probably want to check a blood pressure because after reading in your drug book, you find that furosemide can lower your blood pressure. So I've initialed that. Now for the insulin, I also want to put, that was for her blood sugar, so I want to put what her CBG was before. And then I want to put the site, so I gave this in her left lower abdomen. And sign that off. And so I think that's all. Okay, so that's the end of this video. I hope that you found it useful. Again, I want to encourage you all to re-watch your video before you submit it. Make sure you can hear what you're saying, see what you're doing. It's always good to practice, practice, practice. And if you have any questions, you can always email me on the Canvas site. I'm always happy to answer any questions that you have. And I wish you all the best as you prepare to make your videos. Thank you.